Nurse Sherry here, and today we're going to be going over the CNA Testable skills. Dress a client with a weak right arm. All right, so the first thing we're going to do is knock on the door, provide privacy, wash our hands, identify and introduce our patient. Hi, my name is Sherry. I'll be your CNA today. Can you verify your name for me?
McKenna.
Okay, McKenna. I was just going to get you dressed today. Would that be all right?
Yeah.
All right, perfect. So I just wanted to show you two outfits. If you wanted to choose one, which one would you like? This one? Okay, perfect. So the next thing I'm going to do is go ahead and remove her gown. Obviously, she has scrubs on underneath, but you need to pretend that your patient is naked underneath because that's going to help you make sure that you're not exposing anything that shouldn't be exposed. All right, I'm just going to put your call light over here. I'm going to go ahead and lift this up over you so I can go ahead and remove your gown. All right, so I'm going to just have you lift up. I'm going to untie it. Okay. And then I'm going to remove from, so I always think of start strong, end strong. So I'm going to start with her strong side, which is her left side. So I'm going to go ahead and remove the gown. I'm going to go ahead and put this down so I can show you. But during your skill, you need to make sure that this is covered at all times. Even if you ask the patient to hold it with her left arm, which would make it pretty hard for her to do. So you just need to make sure that it stays covered. All right, so then I'm going to go ahead and remove this side. And I'm going to cover her back up. I'll try to show as much as I can. I'm going to walk on over to the other side because remember, this is weak. Think of it as paralyzed, okay? So I'm going to show you though, so I can show you. I'm going to go ahead and untie this side and bring it down. Somebody that's paralyzed or has a really weak arm, you really got to just take control of that whole arm for them because they can't. All right. And of course, remember, keeping them covered the whole time, your evaluator will be able to see, but I am keeping it down for your purpose of education. So make sure that the gown stays away from your body. And you're going to put that in the dirty linen. Okay. Then I'm going to come in and I'm going to get the shirt that she chose out. I started strong by removing. Now I'm going to end strong, so I need to start on the weak side, which is the right side. So I'm going to place her arm. The best way is to go ahead and get your arm ready in the sleeve, because if this is weak and she can't move it, right? So I'm going to place it over here. And I'm going to ask her to go ahead and sit up a little bit. Are you able to sit up? And while I'm doing this, I want to make sure that I straighten out the back of the shirt so that it's not going to be wrinkly when she gets over there. Okay, go ahead and lean back. All right, then I'm going to come over to this side. And I'm ending strong, meaning I'm going to apply this on the strong side. The reasoning is she can help with this one, right? She could help. And maybe she goes home and she's going to be weak on that arm for the rest of her life. She needs to learn how to do it with one hand. She can take a shirt and apply it over this and put it on herself, which occupational also helps with. All right. Then you need to button at least 2 buttons. You don't need to spend the time to button every button because that takes up time in your skills evaluation. So I would just button the top 2. And I'd have her scoot back up because it doesn't look comfortable. So, and then I'm going to go ahead. Make sure that that's down. Okay, go ahead, lean back. Alrighty. Then you're going to cover your patient back up. Make sure that they have their call light. Does that feel comfortable for you? All right, I'm going to check the bed, make sure that it's locked. In a low, safe position, I'm going to wash my hands and skill complete.